Do, do, do. Okay, there we go. We have begun. All right. So I asked when a few folks were already here, but does anybody have any pressing questions, comments that they would like to get out up front before we dive in for the day? Okay, you guys are still quiet. That's all right. We got a lot to learn. I know this is a lot to take in. This is very different from our current practices. So feel free at any point in time to just unmute yourself and ask questions because I am strictly focused on the showing you guys this functionality. I'm not monitoring the chat or anything of that nature. Jeff and Brandy will be helping out with that when they do get here. Um, so what I wanted to focus on today, I'm just going to give you a little agenda of what we're going to work through before we dive in. So we are going to look at updating a member's Medicare information, somebody who submitted their Medicare information and we need to get that updated. We're going to add a self-pay subscriber who is not already in the system. So we're going to walk through that process. We're going to look at special open enrollment requests. So creating one, processing one, completing dependent verification. We're going to look at termination of coverage, transferring payment methods for a retiree, um, and then updating dependent certification. So if we have those extended or disabled dependents, how we go ahead and update that certification. And then we're going to look at, I think we tried to look at last week, address changes for subscribers. I do know that that is working. So we're going to look at that today, how our members can submit an address change request. So with that, I'm just going to go ahead and dive in. So we're going to log into Benefits 24/7 here. All right. And so first I want to take a look at, I got some information from a subscriber. We got a Medicare card and imaging, however it is that we get the information about somebody updating their Medicare. So I'm going to go in and actually add in that Medicare information for a member. So I'm going to head to my self-pay dashboard here. And I am going to search for that subscriber. So I have my first name. So I searched by first name. Of course, we can search by first, last, or social. So I have my subscriber here, term subscriber. I'm going to select the checkbox to the left of their name and select manage subscriber. I now come to their subscriber dashboard. I am going to select their eligibility tab here. And now we can really see what their current eligibility information is. So if we were to expand the self-pay eligibility information, we see that this member is enrolled in COBRA. We have their agency effective start date, which was March 1st. And they're all of the basically the information that you would be able to see on the 41 screen, you can see in that self-pay eligibility. Now, this person is maybe not necessarily Medicare age, but we're going to ignore that. I want to focus on just actual the manner in which we do update Medicare information. So I'm going to collapse this section of self-pay eligibility, and I'm going to expand Medicare enrollment information. So here is where we would come in and we would actually update that Medicare information based on what the member submitted to us. So they did let me know that they were enrolled, and we will say that they actually provided their Medicare Part A started March 1st, and same for Medicare Part B. I think we touched base on this last week, but I did want to point out that once we enter Part A, and we have a start date, it is still updatable, right? So we can change it. We can update the date if we need to. However, once we select that Medicare Part D is enrolled, we do know that individuals can't have Part B without having Part A. So unless and until we have end dated or removed Part B, we wouldn't be able to remove Part A. So those fields do have some tie together, letting us know that an individual can't have Part B with Part A. So wanted to point that out. I'm gonna go ahead and add our start date here. And then of course we'd want to put in that HICN number. Of course, you guys know I like to make things up here. 1, 2, 3, 4, 5, 6, 7, 8, 10, 11. There we go. And basically, that's all you need to do is just change both of those to enrolled and put in the applicable start date per what they've provided us and update that Medicare HICN number. And then all we need to do from there is hit submit. We get a notification that the changes have been saved. So now we have that Medicare information stored. So pretty straightforward on updating that, but I did want to make sure we walked through that process. So any questions on updating Medicare information for a member?
Are permissions still like we can only make changes and pay one a month ahead of time? Is it the same here or is it different now?
As far as like pending enrollments and things of that nature, Matt?
Yeah, like if if an active retiree is just aging into Medicare, say like right now, we can only do changes a month ahead of time. They're
Mhm.
becoming Medicare eligible, so they're becoming Medicare eligible. We'll say 5/1, so we can't change anything until April. Is that still going to be the same scenario in 24/7?
So it is different, right? Because we don't have to have the same restrictions and benefits 24/7 as operating necessarily on an invoicing cycle. However, so you can add in today a 5/1 effective date for Medicare. However, we do know that Pay One still does exist, and Pay One is still going to get this information. And so that information will not actually be updated in Pay One until invoicing has run and any of those 4/1 information goes to current, right? So is the restriction there that you can only key 1 month in advance? No, but keeping in mind that if you were to do it and to key something further out into the future, it's still not going to make it into Pay One until the allowable time, just based on invoicing cycles. So
Okay,
unfortunately, that
so
part doesn't change.
so kind of, sort of, but pretty much the same thing in Pay One, just not on
Probably
our
best
end.
to, probably
R-
best to
right.
continue with practices of not keying things too far in the future.
Yeah.
But is benefits 24/7 going to allow it? Yes, it will.
Cool. Cool. Thanks, Amanda.
Yeah, thank you. Any other questions on this, on updating Medicare information? All right. So I'm going to head back to my self-pay dashboard here. So we know there are circumstances where we may get a paper enrollment from somebody who's not already in the system. Um, you guys know those circumstances better than I do, but let's say we get that paper form and it's for somebody who is not currently. Um, we've searched for them in benefits 24/7, and we know that they aren't in here. So um, I'm going to, oh, I was going to look for somebody and I looked for the wrong person. So let's just say we got a request from Jody. I can't find Jody in here. So we want to do a search for them first, make sure that they don't already exist in benefits 24/7. And once we know for certain that they do not exist, We want to just start by adding a self-pay subscriber. So we're going to select this button for add self-pay subscriber that's right here on the manage self-pay subscribers page. So we select add self-pay subscriber. And here we're going to enter in their social security number. So information you would have from their documents. And we're going to enter in the applicable agency effective date. I did want to point out, as should be very familiar to you guys, um, it does require, I know it's kind of hard to see. And can you guys see my calendar that pops up? I know drop downs you guys can't see, but can you guys see the calendar?
Yes, we can see the calendar.
Okay. I know it's kind of tough to see because it's pretty light, but all of the all of the days that aren't the first are disengaged, so I can't actually select any of these. It is forcing me to pick a first of the month. So agency effective date, I'm going to select March 1st for this individual, and then I'm going to hit next. And in other cases, if we go back into our time machines of last week, you'll probably remember that when we were adding people who were already in the system, we got a notification that said, hey, this person has been found. Do you want to claim their record? And so in this case, because they aren't already in the system, we're not getting that message and we just have to start all the way from scratch. So we want to go through and enter the information. So I'm going to stick with using Jody. Thank you for letting me borrow your name. And we'll give you date of birth. We want to complete the sex assigned at birth and gender identity. If we have phone numbers that have been provided by the individual, we can go ahead and enter them here. And now we're going to enter in our eligibility information. So let's just say somebody give me an agency that would be applicable for this scenario. Somebody we're adding in who's never been on benefits before but has eligibility for COBRA coverage, retiree coverage. Nothing. Nobody. You guys can't see my drop downs. That's probably the problem. Let's just select 107 TK and we'll go for a COBRA coverage. I'm probably picking things that aren't allowable. You guys have to keep me honest. These are things that your guys' eligibility rules are not as familiar to me. So I'm just selecting options to get us through this ad here. Then we'd select our original agency. We'll just pick one for fun here. We have our pay method. So all of this should feel familiar. This is information that we've received based on the form that they have provided us. Let's select this option and we have, oh my goodness, we're just going to go like this. No, that's not quite the allowable amount of time, but that's what we're going to go with today. And we are originating SSN. I knew it was going to do that. All right. If we had Medicare information, of course, we'd enter that here and then applicable address information. Okay. And this probably seems repetitive. It is very familiar to, already claiming somebody in the system who has had benefits, but did want to walk through adding somebody who's never been in the system before, because there is a little bit of new information we have to provide. So I'm going to go ahead and hit submit. And then now, if I was to type in Jody in my subscriber search, there is there is Jody. So I'm going to go ahead and select Jody here and manage. So now on Jody's dashboard, so in order for us to get to the point of actually completing the enrollment process for Jody based on those forms that we received, those paper forms, we would search for Jody. We would come into Jody's dashboard here, and then we would select the retiree and continuation coverage tile on Jody's dashboard. And then when we get to this page, when it said we need to create a request. So in the drop down, we're going to select it would be whatever is applicable. In this case, we're going to select a COBRA enrollment. So I'm going to select that from the drop down, and then I'm going to hit create request. And here is where we talked about this last week. What is this? What is this question asking us? Would you like to opt out of completing the form? This is a perfect example of where we would actually say yes. We do not want to complete the enrollment form on behalf of the subscriber because we already have that enrollment form. We already received it. It's in our imaging. That's what we're going to be working based off of. So we don't need to recreate that form in Benefits 24/7 since we already have it. So here, when we get the question, would you like to opt out of completing the form? We're going to say yes. So once we select yes on that question of opting out, you can now see that it doesn't walk you through anything else, and it has created the request for that individual. So you can see it here on their grid that their request has been received and it's waiting for review. And so from here, we've now essentially put that work item into the queue to be worked. So what I'm going to do from here, after I've created that request so that we can begin processing the enrollment, I am going to go back to my self-pay dashboard. So I'm going to select self-pay dashboard in my navigation bar. And I'm going to go into my continuation coverage retiree request queue. If it was already assigned to me, it would be showing here as soon as I go into the queue, but I'm going to go ahead and unselect show items assigned to me. And now I see that request for Jody subscriber. So I'm going to expand that request. And then if we have all of the applicable information, because we've received it in a paper form, it's in our imaging system, we would go ahead and apply the applicable status, either approved pending payment or just approved if we've already got the payment as well. So we'll just say that this was approved today. I don't need to update anything here, but if I did need to update, I could change the date or the processing status, but we don't need to since this is just being approved. And then I can go ahead and submit my changes. Once I have approved the request, now you can see we can process those enrollment changes. So I just go ahead and select process enrollment changes. I put in the applicable coverage effective date per what's been submitted on the form. And then I select next. So then now it takes us into that enrollment wizard that we have seen already as we've gone through and processed other retiree and continuation coverage requests. But we just go ahead and select the applicable options as per what we received on the form. So we'll just say this person's going to enroll in Primera Standard. We'll select next. The applicable dental coverage. And because this was a SEB person, we also get the vision options. I'm going to say for this case, we're not going to continue vision coverage, just medical and dental. We'll select next. We have some review information here. And I'm going to give me just a quick second. I'm going to take a quick screenshot of this because we do have a visual bug here and it could be due to our training environment, but I'm going to double check on that. So go ahead and select next. Now it's going to allow us to add any dependents. So if on their form they have an allowable dependent that they could add to their coverage, we could go ahead and walk through that process by selecting yes, and then entering in that applicable information as necessary. And for the case of this exercise, let's just go ahead and add somebody. Might not be a valid scenario, but I just want to walk through the process. And we select our applicable relation. Qualify reason is automatically selected. And we enter our SSN. Our address is the same as subscriber. There is no Medicare information, so we'll go ahead and select what coverages. We would also like this child to be in medical and dental. And we will move to our dependent review. So we can see medical, dental enrolled, vision not selected, no applicable surcharges. As long as this matches the information we have received on the form, we can go ahead and save and finish. And do we have anybody else at this point in time? If there was additional dependents, we'd continue to select next until we have all of our dependents added. Once we've completed adding all of the allowable dependents, we then select no, and then we hit next. We'll get a final dependent review, so it will show us anybody who's been added to the coverage. If for any reason the information, maybe we missed something, maybe they actually were to be enrolled in vision and we missed it and we see here that it's not enrolled, if we need to go back and make changes, we can select this edit dependent button and it will take us right back into that dependent information. So let's say maybe we needed to update the SSN, right? Whatever it is that we needed to do, we can come back through this and it will allow us to make that change, review the information we've already input, and then just confirm. And then once we've completed that, we just select no again, and then we can continue on our way. So that is our opportunity to edit those dependents as we've moved through the process if maybe we made a mistake or forgot to key something. Once we've completed that dependent update or upload, I guess, we select the let's upload documents. Since we should have already received those in as part of the paper application, we don't necessarily need to complete this portion. So we just go ahead and proceed to attestations. And this is on behalf of the subscriber. So we select the applicable tobacco attestation and select next. Confirm the legal notices here. And now we move into our review. So we can confirm the subscriber and any applicable dependents, what coverage they enrolled in, and what their coverage effective dates are here. Select next, and then confirm. And now we have completed that full enrollment process for somebody who we have received paper documents. And I want to point out, we did that process from the perspective of, hey, we received a form for somebody who's never been in benefits 24/7. That same process would be replicated for an individual that we have already found in benefits 24/7, but maybe they submitted a paper document instead of used benefits 24/7, because we do know that this is going to be a process for people to adjust to this new system. So in the case that we received a document for somebody who's already in the system, we would go ahead and from our self-pay dashboard, we would search for the applicable subscriber, um, select the subscriber and manage. And then we would go straight into their retiree and continuation coverage page. And we would just go ahead and select that applicable enrollment event. So if it's a COBRA enrollment, a retiree enrollment, we would select that option. We'd create the request, and then we'd opt out of the form. So that's how we can then get into processing that and completing the enrollment process. Does that make sense, or do we have any questions on that process? Okay, quiet group still. All right. Next, I wanted to move on to creating a special open enrollment request. So I want to show you guys what that process looks like of actually creating the request, and then we'll move into processing and completing applicable dependent verification as part of that. So I know I guess I'll take a moment here too and say I do recognize that as part of your daily work activities, you guys won't be the ones actually creating the request forms. I do recognize that. However, I wanted to walk through that process so you guys can see what it looks like and get a feel for what our members are having to go through as part of submitting that request. Because inevitably we'll get phone calls and questions, and maybe somebody is right in the middle of submitting that request and they may have questions. So while I do recognize it's not part of something you guys will be doing every day, I did think it was important to walk you guys through that portion of things before we just jump into processing the request. So hopefully you're finding some value out of that. All right, let's go into special open enrollment. So I'm going to search for my subscriber here. And again, I'm going to show you guys this process of creating the special open enrollment request from the perspective of our members, and then we'll move into processing. So I searched for my subscriber and I have landed on the dashboard. I'm going to go to the special open enrollment page here. And then from the drop down, there are two options here. There's a special open enrollment request, and there's a change of address. And you know what? Let's just go ahead and I'll show you guys the change of address first. I was gonna had it on my list for the bottom for one of the last things, but let's go ahead and do that here. So if I select a change of address and I add new event, this brings up just the residential and mailing address fields. If there was dependents on the account already, we would see those dependents listed below, and we would have the opportunity to add um, a new address for our dependents. So this is an opportunity for the members themselves to come in and submit a request for changing their address. So let's just go ahead and say this person moved to Olympia and we update the county and zip code. My mailing address didn't change. I'm going to go ahead and hit submit. Now that change of address, it says it's waiting for a review. So I'm going to go back over here to my self-pay dashboard and I'm going to go into my request queue. I'm going to unselect this option. And you can actually see right here that my subscriber has submitted a change of address request. And I can see on the form what they have requested to do. So here is their address change. I would see any additional information if there was dependents that we changed. If that looks good to me, I can come in here and approve this. I don't need to change anything. The process date automatically populates for today and says complete, and I can just go ahead and submit changes. So when it's an address change, all we have to do is come in, we'll see it in the queue, we review it, we can take a look at that form, and then we submit changes, and now it's been completed. So we don't actually have to go in and key that change. That change has already been made. So if we go back, I'm going to go back to my dashboard and I'm going to search that subscriber again, and I'm going to manage them. And just to show you guys that that change of address automatically applied, I come in here and if I select their profile and I can expand the residential address, here you can see that address change has been made. So pretty cool. We heard that request loud and clear from many of you guys that this would be super slick to have in benefits 24/7, and I'm happy to say that we were able to get this one accomplished pretty quickly and easily before we went live and give members an opportunity to submit that address change through the system. Any questions on that address change? Okay. Marking off my list here that I got that done. Okay, I'm going to go back to my dashboard and let's go back to creating a special open enrollment. Here, I'll take a moment to acknowledge that we see that change of address event, and the member themselves can come in here now and see that that was approved. They would not be able to delete this, right? Because it's already been approved and applied in the system. They could still download that PDF of what they requested in case they need to review that. All right, so now let's go ahead. I'm going to select the special open enrollment request, and I'm going to add new event. So because I'm showing you guys this from the perspective of the subscriber, I am going to not opt out. But again, if we got a change form in our documents, paper version, then this is where we would say yes, and we would go through the request queue. But here we're going to actually walk through that process so you guys can see what that looks like. Again, should feel pretty similar to how the paper form is laid out. It's going to ask us to select the applicable event from the list, and has some information about what each of these events are and what documents they can submit to verify that event. For today's case, I'm going to select loss of other coverage. I am going to add a dependent to my coverage. So once I've selected my applicable event, I'm going to select continue. Here, I want to select what my payment option is. We'll just go ahead and say monthly invoice, and I'm going to proceed to the form. So here it should feel and look very similar to the initial enrollment form. I'm going to go ahead and select that my mailing address is the same as residential. If I had Medicare information to provide, if maybe I was gaining eligibility for Medicare, here's the opportunity that I would input that information. For today, I'm going to go ahead and just select no. And then update or select my applicable tobacco surcharge here. Nope, I am not subject to that surcharge. And then here's where I'm going to go ahead and add a dependent. So I'm going to select the add dependent option. I'm going to expand this. First and foremost, I'm going to select my relationship. So go ahead and select that I'm adding a spouse. And we'll just go ahead and start entering that information. And we will say, select our information here. All right. When were we married? We were married in 99. Okay. Then I want to select the coverages if I'm covering or removing from coverage. Remember, this is based on the paper form. So all of the options are here. This could be used for both um, adding somebody to coverage and removing them from coverage. So we do display both options. So I'm going to go ahead and add them to medical and dental and select the tobacco surcharge question. Here in this case, we're not subject. And then it is going to ask us the spousal attestation surcharge questions. And so we have links to the applicable help sheet for the member to use. Otherwise, they would select their applicable yes or no. And I'm going to say no, and I'm going to answer question number 2. I know that the spouse is no longer eligible for employer coverage. So once I've completed all of those options, I'm going to select Save Dependent. And if I had additional dependents to add as part of this special open enrollment, I would continue to add dependents until I have completed. In this case, I was just going to add the spouse, so I'm going to hit Continue. And then, as we know, special open enrollments sometimes do allow us to make a change to the medical coverage. So here we could, the individual would be allowed to select a new plan. For this case, we'll just select UMP Select and hit Continue. Enroll them in Uniform Dental Plan and select Continue. And then the member would want to make sure they upload those applicable documents. And so in the case of adding a spouse who has lost coverage, of course, we would expect to see some kind of verification for the spouse, right? A tax return, marriage certificate, whatever that case may be. And then also probably something like a termination letter for the spouse, something that shows us that they lost that other coverage. So I'm going to go ahead and select my tax return here for my spouse. And I'm going to select that this was a tax return. I know you guys can't necessarily see that. I'm going to select one more file here. And we're going to pretend that this is a termination letter. Close enough, approved leave. So once all of the documents have been appropriately added, we can go ahead and select upload and submit changes. And then if we have any more, they can continue to do that. Otherwise, we will select continue. And then the member has the opportunity, of course, to download that form prior to submitting. They can also download it once they have submitted, but gives them that information. If you still need to edit, use the previous buttons and you can go backwards into the form and make changes. Otherwise, go ahead and select submit. So now we see that new special open enrollment request has populated here. We see that it's pending, waiting for review. Again, we have the ability to edit and we can delete if we need to at this point in time. So with that being said, we have witnessed a member submitting a special open enrollment request. So I'm going to go back to my dashboard and you will see a couple of things here. You see that there is dependent verification, which we're going to come back to here in just a moment. And we also have our request queue. So I'm going to go back into my request queue, unselect items assigned to me. And here we see the bottom item here, special open enrollment request for our subscriber. So we can expand that request, and we'd want to, review the information, right? They submitted an SOE for loss of other coverage. Um, and we'd want to open that form. So I'm going to select the form here. I'm going to open this form. I have some information on what the request is, what the special open enrollment type was, loss of other coverage. We have information on the subscriber here. And clearly we have a little bit of work to do on this form because it is falling off of the page. I don't know if you guys can see that. Um, so we'd want to review this and make sure that we have all of the applicable information before we start actually processing this. Everything looks good to me. So we saw as part of that request that a spouse was being added. So at that point in time, we can take a look at the attached documents. Okay, this tax return looks acceptable to verify the spouse. We're pretending this is a termination letter. Yes, this document looks valid to approve this special open enrollment request. So I'm going to go ahead and move this into approved. We don't have the pending payment, right? Because this person is already enrolled in coverage. This is just a change to their account. So we don't need to have that separate approved waiting for payment option. We can just go ahead and approve the request. So I change it to approved, update in any information as needed, and then submit changes. Again, as we're getting used to, once we submit the changes, now we have the opportunity to process those enrollment changes. So we take a look on that at that form, and based on when we received the form and what the dates were, it was submitted on 3/22 for loss of other coverage. We know that this is actually going to take place for April 1st. So whatever the applicable coverage effective date is, we want to enter that here and then select next. And again, this is all going to feel very familiar. Same layout. We're always going to start with coverage. We'll move into the dependent section, complete attestations, and then confirm that we're done. So based on the form that we received, the member selected UMP Select. So we'll go ahead and select that medical plan here and hit next. We already know that they selected Uniform Dental, so we can keep that selection here or change it as applicable. Select next. We see that coverage effective date and what those plan options are. Perfect. Now I'm going to confirm and manage dependents. So here, this is a little bit new and different from what you guys have seen. So it's telling us that, hey, this person has a dependent that was added on the enrollment change form. We see their name, their relationship to the subscriber. And then we have this new button that says import this dependent. So if we select import this dependent, it takes us right into that dependent information. So it's going to already pre-populate with what was input on the form. So if there's any changes that need to be made, we can go ahead and do that at this time. We know the address is the same. They did not provide an additional address. If there was Medicare information that needed to be added or changed, we could do that here. And then moving into add coverage. Oops, I missed a field. Qualify reason was married spouse. Okay. And that's a good thing to call out. Oh, I missed another field. If at any point in time when we're walking through benefits 24/7, we will get messages like that. Hey, you didn't complete required fields, and any field that wasn't completed that is required will be highlighted like this in red. So that means that you do need to complete that field. So go ahead and select that, and now it's going to let me move forward. All right, we see that they were wanted to be added to medical and dental. So if we need to make a change to that, we can. Otherwise, just go ahead and select next. And per the form for the dependent, the tobacco attestation was no. And I do recognize we will make sure this form looks a lot better. So I'm going to select no here. And per the spousal attestation, we do know it is a no, and they answered no to question 2. So I'll go ahead and select no to question 2 here and select next. All right, they're not going to pay. Let's proceed to the dependent review. Double check that all of this information does look correct. And once it is, we can go ahead and hit save and finish. All right. So here again, if there's additional dependents that we know about, we could add them by selecting yes. In this case, I'm going to go ahead and select no, hit next. And now again, we see that spouse that's been added to medical and dental, no surcharges apply. We can go back in and edit if needed here by using this edit dependent link. Otherwise, go ahead and move on to the next step. We can move past this document upload page and proceed to attestations. Acknowledge the surcharge information. We automatically populate no, the subscriber is not subject to it. Acknowledge the legal notice and then move on to the confirmation. All right, so here we see the subscriber, new medical coverage effective date of April 1st. Their dental coverage remains back to when they were enrolled. And then we see that new dependent added and with the applicable effective dates. And whatever those plan options are that we have input, and we select next. And then any additional coverages, of course, here, retiree term life coverage is not enrolled. We select next, and then the final legal notice here and confirm. And now that special open enrollment has been processed. However, we are not 100% done with this special open enrollment request because we have not completed the dependent verification portion, right? We did complete adding that spouse to the coverage per their request, but we do need to verify that dependent. So I go back to my dashboard, and now I'm going to go into my dependent verification section. So one of my favorite sayings that, I'll be honest, people say this to me quite a bit, and I don't know that I 100% acknowledge or recognize what this saying is trying to convey. But many people say it's 6 to 1, half a dozen to the other. You can do the dependent verification first if that is your typical working order, verifying the dependent prior to completing the special open enrollment changes. Either way, this is what made sense to me, going through, reviewing the documents, making sure that everything was valid, completing that enrollment process, and then coming in and going to the dependent verification. But I will leave that order of operations up to your guys' team on how that process is outlined. However, once we need to complete that dependent verification, we come in to the dependent verification queue, and we can see that spouse that we just reviewed, and we expand that record. And we already know that per the documents that we reviewed, that they were good to go. We looked at that tax return, we saw that termination letter, everything was good to go. So we can just come in here and we can complete that verification, change the status to verified. Select the applicable verification status. It would just be verified. Today's date is populated, and then we'd select the document that they uploaded. In this case, it was a tax return, and then we'd submit changes. Now we have completed the process. We've walked through what it looks like to submit a special open enrollment request. We walked through processing that special open enrollment request and those changes. And then we completed the dependent verification of adding that new spouse. Questions about that process? Questions. Okay. All right. Well, next I wanted to look at what about if we need to terminate somebody's coverage? We got a request from, of course, it could be done many different ways, right? Somebody submits an actual request in benefits 24/7. Let's just say they sent in a document. So we received it through our imaging program and we have that in our queue to work. And we need to go in and terminate somebody's coverage. So I would come into my self-pay dashboard and I would search for my subscriber. So I'm actually going to use the same person that we were just looking at for making things easy. And I'm going to search for them and then I'm going to go ahead and manage that subscriber. And then in order to complete a termination, I'm going to select their eligibility page here. And then we come into self-pay eligibility and we want to expand that section here on their eligibility page. We see this field or this section for terminate and transfer. We're going to go ahead and expand this drop down. So there are a few different options in this drop down. There's change of eligibility type, death, defer due to Medicare, Medicaid, defer retiree coverage, non-payment, and self-day and date reached. So in this case, trying to I'm thinking in my head if all of those are the correct termination reasons. In this case, let's just say that we received a termination request or a deferment of our retiree coverage because this person is going to go back to work. So we'd come in and we'd select the applicable termination reason here, and then we could enter that termination effective date. I'm going to go ahead and select April 1st. I know we just did a SOE for this person, but for the ease of working through training, I am reusing folks multiple times. So we come in here and we select the applicable effective date for termination and termination reason. And then I just go ahead and submit changes. And then we can see that their benefits will end at the end of April. Easy as that for terminating coverage. Questions about terminating retiree COBRA unpaid leave coverage? All right. Okay. So one of the things that I'm going to go back to my self-pay dashboard here. One of the things that I was asked to talk about is what about retirees who change their payment method? Typically, this is a transfer. They're transferring the payment method. And I do believe that we have a work item to allow for transferring for our self-pay folks. However, I do know at this point in time, um, we don't have that transfer option available in benefits 24/7. So when that does change, we will be sure to communicate that out and provide updated instructions and information on how that transfer works. But for the purposes of today, I want to actually walk through how we would make that change in the system as it is right now. So what we're going to do is we're going to find our subscriber, and looking at the wrong person. Okay, I need to update my notes over here so I don't get confused. I'm going to search for my applicable subscriber that we know is, we received the request to change their payment method. I'm going to manage them. And then I am going to go into their eligibility. I'm going to copy this for my easy use here in a moment. And I'm going to expand that self-pay eligibility. And in the termination drop down, I am going to select change of eligibility type, and we will use, let's just say, end of March, and I'm going to select submit changes. So I have successfully terminated this coverage. So now what I'm going to do is I'm going to go back up to my add self-pay subscriber. So this is when somebody's payment method has changed. We first terminate their coverage, and then we are going to add them back with the correct information. So I enter their social security number. I put in the agency effective date, which would be first of the following month when that payment method change is applicable. And I select next. I get that notification, hey, this subscriber record has been found and they can be re-enrolled. So I'm going to go ahead and claim this record. And here I'm going to just double check everything's correct. And then I'm going to go back into updating the eligibility information, adding that self-pay origin record information. So select the agency, sub-agency, their eligibility type. They are a retiree. Eligibility reason of 01. Oh, I can't remember what we selected here, but we'll just select a random one. And then here's where we would update that pay method. So we now got a automatic account withdrawal. Let's say that's our change to the pay method. So we select that, update the originating SSN as applicable, and what that retirement date was. I can't remember what I had in here, but we'll go ahead and select that. And then if we need to make any changes, we can, and submit. So basically, once we've done that, go back in and, Jeff, as I think about this, when we have to term and re-enroll, we have to do we need to create the request again?
Self-pay, so term and
Term and
re-enroll.
re-enroll for payment method change.
Oh, yeah, we know that that can actually be done via transfer in Pay One right now, but we don't have that functionality in the front end. So at this point, until that changes, it will need to be a term and re-enroll.
Okay, so we'd have to go back through creating the request and then processing that information.
Yes.
Okay, so we'd walk back through that same process of creating the request, and then we would opt out at this time because we don't need to complete the form on their behalf. And then we'd go back into our process of processing that request and adding the enrollment. So I won't walk back through that because we've seen that process now several times, but did want to acknowledge that how we would change the payment method. Any questions there? Okay. So I will say, I think I just have one thing left on my list to go over. So we are going to finish early today unless you guys have questions or have additional things that you would like to maybe talk through in the system. Um, I did recognize that we were probably going to finish a little bit early today. So um, the last thing I wanted to touch base on was what about we've received a request and we have a disabled or extended dependent, and how do we complete that process? So in our dependent verification queue, I'm going to go ahead and come here. So I'm not entirely certain if you guys have designated folks who complete the disabled dependents and extended dependent review, but the process for disabled and extended adding the certification is the same. So so I just wanted to walk through what that process looked like. So here we have in our pending request queue a disabled dependent. And let's just say I do realize that this request is quite old, but let's pretend that it was current. Once we expand that dependent request, we can see here that there is a verification document attached. So we'd have our dependent verification portion. We also know that in the case of a disabled dependent, they have to provide certification. It has to go through the plans, etc. But let's just say we've received that certification and we need to update and add that certification in the system. So first and foremost, we want to make sure that we complete the verification. So this dependent was verified and we got the applicable tax return and we can submit the changes. Now you can see that they have been verified, but they are still pending certification. So I'm going to expand this record again. And now I'm going to expand this additional section down below for certification. Here is where if there was already a certification tied to somebody, we would see a record of that. We'd see the certification type with a start and or end date as applicable. I'm going to add a new one. So for a disabled dependent, there are two options. There's a temporary certification and then there's a permanent certification. If this was an extended dependent, there would only be one option, and that would be temporary because we know they cannot be permanently certified. So because this is a disabled dependent, we do have the two options, which I recognize you guys can't see. But for today, I'm going to go ahead and select temporary. And I'm going to put in the applicable start date. So let's just say it was effective March 1st. And then because this is a temporary one, we do know it's going to end at the end of this year and they will need to recertify. Once I have added in that start and end date, I want to go ahead and select save. There is one more small thing that we need to do for the certification. And so the certification has been added now, but we do want to come back in here and under the status, we want to change this status to approved. So there's a few different options in here. It is automatically selected as pending until it's been approved, but we want to go ahead and select approved. And then the person who is reviewing that would put in their review day. So I'm just going to say today, and then we automatically see the start and end dates populated per what we've included in the certification. And then we submit. Now that dependent has not only been verified, but their certification has been completed. And then we are done. They're no longer in our dependent verification queue. So we have completed that. One thing to note, much like the request queue that we have spent a lot of our time in, this page, the dependent verification page, also has a show only pending request option. This is automatically going to be selected because first and foremost, we want to make sure we're looking at those pending requests. But if you do need to search for anybody who's already been verified or denied and maybe need to make an update, you can unselect that checkbox And now you can come in and see any dependent who has been verified. And you can come back in here and let's just say, for whatever reason, maybe we need to change somebody's verification status. Let's hope not. But in this case, we'll go ahead. I'm going to change this, this dependent to denied. And then we can select the applicable verification status. We have denied, illegible, incomplete, invalid, no documents provided, or maybe they didn't respond. So we'll just go ahead and select incomplete and I can submit my changes. So that is the dependent verification portion. So at this time, we have really walked through all of the main pieces of using benefits 24/7. So I'm happy to answer questions, to walk through anything else if folks want to see something else again, or if there is nothing, I'm happy to give you guys back some time. So up to you guys. Anybody want to see anything again? Everybody's
I
just
have a
like,
question about the attestation pages and specifically the spousal attestation. I may have not caught it when looking at it, but I think there was an option tobacco attestation for subscribers enrolled in Medicare. Did we also have that on the spousal attestation?
so great question, Jason. When the subscriber themselves is enrolled, has Medicare, then we automatically select no as the applicable responses for the tobacco and the spousal so that they don't have to complete those attestations.
Okay, okay, thank you.
Yeah, you're welcome. Other questions? All right. Well, if there's nothing else, feel free to have some additional time back in your day. I will stick around. Thank you guys all for coming and looking forward to this launch of Benefits 24/7. So thank you all. Have a wonderful day.
Thank
Good
you.
job.
Amanda.
Good job.
Thank
Hey,
you.
have a good